Hello everyone, my name is Snehal Desai and I'll be just going over briefly on some mechanistic structures of how seizures develop. Uh, so we'll look at some diagrams here in a minute, in a few minutes. Let's wait for some people, so just hold on for a couple minutes, okay? Just going to see if anybody is available. I know some of you might have a little hard time understanding some, concepts on this section on epilepsy. So this is just a brief illustration. Hopefully, it's it's going to boost some powerful concepts or some concepts to um, understand um, seizure mechanisms uh, a little bit better. So feel free, and if you have any questions or you would like to say anything, you can just go ahead and put it in the chat box, and I will get to you as soon as I can. Um, just another 5-10 minutes, and then we'll start this lecture. Does anyone have any question right now, whoever is watching this, on any of the topics that have been discussed so far, or anything at all related to pharmacology, or any of the concepts that we have already discussed previously, um, as it pertains to pharmacy or NAPLEX or anything. Um, and if you do, you know, this is a good time to ask any questions, um, so that we can clarify or clear up any concepts that you might be having trouble understanding. So feel free to utilize this chat box, and I will get back to you right away after this lecture as well. So um, and you can always utilize the channel to write any, if you have any questions on there, you can leave a comment. Um, I know some of you have, or some of you were probably wondering um, how often or when these videos get posted. Typically, these live videos are not, um, there's no set time period when these videos could show up, but we are trying to make it a little more structured format for you all, so you guys don't hear about this live video at the last minute. Um, it's just as of right now, we are trying to add as much information as we can whenever it becomes available, so that we have all the concepts um, added in for you all, so you guys can utilize it whenever you'd like. You guys can review it, you guys can, study it, and we will continue to reinforce a lot of the information that has been previously discussed in in our YouTube channel, with even updated information as well, so you guys can use that to your advantage. Um, our video series on this NAPLEX review course isn't just isn't just for people who are studying for the NAPLEX course, but also to make them better in practice as well. Because a lot of the material that you have to know for the exam is to is also useful when you go out and practice as well. Whether you're in retail pharmacy or hospital pharmacy, it does not matter. At one point or another, you will encounter situations that you have seen before, whether it's on the exam or off or somewhere else. So, and these videos are always going to be there for your reference. You guys can always review them. They are there for your reference, for your education for your review, for your practice. Um, so, and you guys can all, you guys have all of the access to these videos, so you guys can use it and, continue to um, learn as well. So the purpose of this video right now is just it's a very short video. There isn't too much information here. I'm probably going to split this into different parts so you all can use this, because epilepsy is not a very small topic. It's a quite big. It's a big topic, and um, that is why I feel like um, I don't want to overwhelm you with the details. So yeah. So I'm just gonna give it a few minutes right now and see if anyone has any questions while they're on right now, or just a few minutes, and then we'll get started. Okay. But as I mentioned earlier, I am trying to make it more into a structured review so you guys can get a notification in advance as to when our live videos come out, so you guys can uh, you know schedule accordingly when to you know watch it. So um, do apologize for the short notice, but I feel like I feel like this concept is important to understand, so I'm going to show it to you all now for your review. Just a couple more minutes. All right. Let's get started here. So, can someone tell me what epilepsy is, or what this is all about? Um, so when we look at epilepsy, um, there can be different types of epilepsy that can occur. Epilepsy is essentially like um, you can just consider them like seizures, basically. And what exactly is a seizure? Seizure is going to occur whenever there is an abnormal firing of um, these neurotransmitters. And these neurotransmitters are things like, excitatory neurotransmitter. Like, what is considered excitatory? In pharmacy school, or even while you're studying your NAPLEX materials, you probably heard of the concept of GABA or glutamate. GABA is actually inhibitory. Glutamate is excitatory, which comes from glutamine, which is what the neuron makes, and that releases it as an excitatory neurotransmitter. Now, normally, it kind of stays balanced. The GABA and the glutamate, they kind of get released, and they are actually um, work in, so that one balance is balanced with the other. However, there are cases when an abnormal firing of glutamate neurotransmitters get released and then excites on the next neuron, then the next neuron gets excited. Then it just keeps exciting. And then that's where like all this firing occurs in the brain area, and then it's going to lead to seizures. And seizures, um, patient will basically um, lose the thoughts. Maybe they might not be able to function as they normally would. So, before we start, I did want to mention some of the topics that were covered on NAPLEX. When it comes to neurology and psychiatry or psychology and those kind of areas, um, you can see here, like we already kind of discussed, or at least given you a preview of how depression is, the medications used to treat depression, and some of its symptoms. We also talked about that there might be some overlap with anxiety, and so some of these other topics I haven't really discussed yet, but you will see these later on in the future lectures. Um, and as I mentioned, like Parkinson's disease and Alzheimer's disease do not get mixed up between the medications there. Um, so just feel free, if you have any questions on any of these topics or any of the previous topics that were previously discussed in our NAPLEX review course, you can actually um, comment in there, or you can just let me know personally. You can go on our Facebook page and message us as well, and we will get back to you on that. So let's move on to epilepsy. It's basically an excessive neuronal firing in the brain, abnormally resulting in seizures. That's when the excitatory neurotransmitter exceeds the inhibitory activity. So when that gets fired, there's too much glutamate, coming out. And we'll talk a little more about the sodium and calcium influx and all. And then there's too little GABA. GABA, which is another type of neurotransmitter, but it actually inhibits the excitatory process in the brain. So that's actually to balance it out. So we'll go a little more into the basic neuron structure, so you guys have an idea of. And when you look at this, I want you guys to take note or take um, a notepad or draw a picture um, of this, because this next slide is probably going to help you answer, or even at least have the basic understanding of everything that's within this chapter of epilepsy, or you'll have some sort of basic understanding from this slide onwards. So let's take a look. I know this diagram looks messy right now, but believe me, you're going to have a really good understanding here. When you look at a neuron, and in your class, or in your lectures, or anywhere you have seen it, you probably have seen something look like this a lot. Like, hold on, let me try to draw it out here. You probably have seen something like this, where you have like two things, kind of like a opposite sides of a vase, kind of like looking like this, and then like this is the synapse here, synapse. Okay, and so that's good and all, but I want to make sure that you guys get the most understanding of it. So where you can see a neuron, I want you to understand a neuron cell itself. A neuron cell is something like this. You have the dendrites, you have the axon with the myelin sheaths. You probably learned this in basic anatomy, physiology, and then you probably have seen these bottom terminals or axon terminals. And you probably heard of the term action potential. So what is action potential essentially? And why do we care about it? It's basically a method of turning on a light switch, for example, or, signaling another component, or another fuse to turn on. So let's think of it like this. So, and let me kind of draw it out here on the side for you so you guys can see. So here you have like these little tiny hairs, or I guess we can draw a little nucleus here, and then you got this little bit of and I know my drawing isn't perfect, but you can see here you got a axon or soma right there, okay? And then right here at the end of the axon is the axon terminal, and you could see it's like little fingers, coming out of it, and you can see here this finger here. See here, take a look, this finger here. Now, I'm wanting to explain something here. What do these fingers represent? What are these fingers? Well, each of these fingers is kind of like a little connection point. So like this is connecting. So let's take one of the fingers at the axon terminal here. And you're about to see that this finger is now going to touch one of the dendroids of another soma. So that's essentially what this enlarged figure is here. And then this right here, when they touch, Actually, let's turn that off real quick. Let me choose a different color here for your reference. So like right here in this area, this is your synapse. Now, and let me try to draw this to show that's like the axon right here. And then again, you have another pair of fingers, kind of, I know it's not great, but at least you can understand the concept here. That is most important. So you can see here, this is basically like your synapse. So between these two, this is what is showing here. It's like an enlarged figure of that connection between the dendrite of one neuron and the axon terminal of the other neuron. And so, and we'll get to action potential in a minute. So how do these two connect? So look at this terms here. You see sodium. Sodium is typically on the outside of the neuron. And whenever it's at resting phase, the neuron itself is negative. Okay? It's a negative membrane potential. Are you all there? Hello? Okay. So I wanted to mention here, because if you look here, so as I was mentioning, like that's the connection between the two neurons right there, like the presynaptic and the postsynaptic neuron. But then in between is the synapse. Now, whenever you see this sodium is on the outside, this membrane potential is going to be negative. And that's actually our resting phase. Whenever the sodium channels open up, and the sodiums come inside the neuron, that's when the membrane potential becomes positive, and that's when depolarization occurs. Now, potassium is already within the neuron. So when you add the sodium, it's going to make it more positive. So it's going to be depolarized. Then eventually, potassium is going to be released from the neuron, and then the voltage is going to become more negative. So, and then it goes right back to resting. So, that's essentially like how it would end up in a normal situation. It starts from a positive, then it gets to negative. Okay, so action potential occurs right where depolarization occurs, when the positive sodium ions, or the sodium is going to go then inside the neuron and then depolarize it, make it membrane positive. And then what happens next? The next thing that's going to happen here is you're going to see whenever sodium comes in and then runs all the way down the axon potential to the axon terminal. Okay. And notice that, they're actually probably coming from up here somewhere, before, and then coming on down the axon to the axon terminal. Okay. And then it's going to trigger another channel, which is the T-type calcium channels. And these calcium channels are going to come from the outside of the um, neuron, and then it's going to go right in, and then calcium goes inside, and this is what action potential is essentially when that sodium is going to reach to the axon terminal and then trigger a opening of the calcium channel, so the calcium can go inside the neuron and release the neurotransmitters that's within the vesicles that are within the neuron itself. So you can see some of the glutamate particles. You can probably see some of the, let's say there's some other particles here. Anyways, so the main point is here, okay, so calcium goes right in there, okay? And then it's going to trigger a release of these glutamate, for example, particles from the vesicles, and it's going to come right out into the synapse. And then that glutamate is going to trigger a release of more sodium into the dendritic part of the other neuron cell. And that's where it's going to do another round of signaling and then opening up channels and then releasing those, the particles from the vesicles and all of those things. So, technically, when there is too much sodium channel activity, when there's too many action potentials, when there's too much calcium triggered neurotransmitter release, okay, then and too much excitatory signaling, like we talked about glutamate, and all of these many neurons fired together like this, that's how seizure is going to develop. And so that's this right here is going to help you out on this entire section on seizures. So make sure you have a really good understanding of at least the basic pathways of the neuron cell, and how the electrical activity works, so that you guys can learn how to implement some treatment strategies to help prevent seizures in various ways. So let's take a look at some treatments now and see how we can prevent further seizure events. As I mentioned, the other neurotransmitter that gets released is the GABA, and GABA is an inhibitory neurotransmitter, and calcium also releases GABA as well. So calcium is like, it's kind of like signaling particle. Think of calcium like in the heart too, like it contracts. You're kind of pushing that blood out of the heart to the other parts, to the other system, the other organs, to get the nutrients it needs to those cells. So similarly, this is kind of like you're doing that sort of contraction to release the neurotransmitters to go to another neuron or the other side. And that's essentially what's happening in this diagram. So you could kind of make those kind of connections as well. Because there are certain connections here you can make. So just understand that. This diagram should not be a very scary diagram now. at least given the fact that you already have the basic understanding of the neuron electrical firing and all. So look at this without looking at any of the square boxes, and you could see here, right here, you see how there is a sodium coming right from the axon and to axon terminal area, going to depolarization. It's going to make the entire membrane positive, and then you're going to see that depolarization is going to trigger calcium to come right on in. Let's go ahead and open up the boxes. Let's open up these presents, let's say, and these presents that are going to be released to go to the other side where the GABA receptor is located. And I'm going to show you in this previous diagram here. You probably see these receptors right maybe here. You could probably see them right here, basically around where the receiving end of the other neuron is. So if you see that, you can probably understand now how it's actually working. And chloride is inhibitory, inhibitory, like you could say like a neurotransmitter, but it's like another chemical there. So, and sodium is excitatory. So you could see how it becomes like positive, like you're excited, it's positive news. So that's essentially what that is here. So glutamate and GABA are basically both being released, and one of the receptors that glutamate, attaches to is the AMPA receptor that's used to release more sodium into the postsynaptic neuron, which is the neuron that's receiving, the neurotransmitters or excitatory neurotransmitters. So you can see here, that's what's going on in this basic diagram. Now, as I mentioned in this previous diagram, too much sodium channel activity. So if there's too much of this sodium channel activity, sodium just keeps coming in and coming in and coming in. Like too much of this, we need to kind of control that. We're going to have to put a stop on this. So these are the types of drugs that will help with slowing down the sodium channel. Then you have this other type of I guess you can see the vesicle releasing it. So I guess you can see levetiracetam is kind of playing a role here for that. Then ethosuximide is special because it actually basically deals with absence seizures. Not that we're going to go into specific seizure types in this lecture, but at least just understanding this one is just mainly focused on the calcium channel itself. So right when calcium is going to cause a release of those neurotransmitters, it's going to close up that channel so that calcium does not interact with it, or as I mentioned earlier, like kind of contract or cause that type of contraction to release the neurotransmitters from one neuron to another. So that's what ethosuximide will do here. There's some other drugs here. The perampanel, which is pretty much inhibitory for AMPA receptor, it looks like. And then the thiagabine, it has other mechanisms here, like the GAT1. And then the benzodiazepines, which is going to basically allow more of the GABA from allow more of the GABA, or keeping the GABA channel open, so more, there could be more inhibitory activity, to balance out the excitatory activity that goes on between, um, neuron A and neuron B. So, um, this is just a basic, diagram. I hope this kind of helps you all to kind of understand the overview of a lot of these anti-seizure medications, in terms of mechanisms, just in this one diagram. There are some other drugs here that's not illustrated, like vagobatrin, which is actually going to decrease the GABA degradation, and then valproate, which is going to decrease sodium channels, or kind of like not, keep it open for so long, um, you know, removing it, keeping or prolonging the time in its resting state, and all of those, and then decreasing the NMDA receptor use, which is, also what glutamate uses as well. So that's another one to know as well, in case you get a test question asking you which of the receptors glutamate, is it A, is it, um, it could be any kind of receptor. It could be GABA receptor. Does it interact with GABA receptor at all? Does it interact with B? Does it interact with the NMDA? It could be all of the above. Or C, it could be AMPA. And these are things that you need to understand. These kind of receptors, because they kind of play an important role in terms of, seizure, types and all. So, just have a little understanding of that. We'll go over more of these kind of receptors in the future lecture. I just wanted to give you a little bit of overview here. Then you have felbamate, which is another type of drug. I haven't ever really seen it used. I haven't even seen it really much in practice. It's another drug to also, lower the use of the sodium channel and the NMDA receptor, so you can see less of the excitatory there as well. So these are some of the drugs. These are the few drugs that you might come across, on an exam. Um, but my main point in this lecture was to make sure that you actually had a basic understanding of how this how the connections work between these neurons, um, especially it's going to help you with a lot of understanding with seizure medications and all. So just to understand on that. Um, and this one was pretty interesting, the retigobine. You can see how it's kind of potentiating the, potassium as it comes out of the, um, neuron. So, like I mentioned, that's just repolarization. So it's coming out, making it negative again. So that's actually a good thing. So it'll kind of repolarize the neuron. So that's interesting there. So you guys, just take note of some of these medications, um, in terms of like mechanisms and all, and, just see, just you just have to see it. You don't have to. You're not here. We're not here to memorize every information. I do, however, expect you all to at least have an understanding of all um, uh, the the narrow therapeutic index. I think there is a value that has to fall between. You guys should have an understanding of that. Um, it should be in your course book or in your NAPLEX materials, or in your pharmacy literature. So just kind of understand that there is, um, a limit on how much um, phenytoin, for example, can be used. So just kind of take, and also some of the toxicities that line up with these things, like Stevens-Johnson's syndrome, or you know, someone having severe rashes and all. So it's important to have a understanding of some of the toxicities as well. And these are some other diagrams like ethosuximide. I can label like calcium channel blocker here, um, carbamazepine, kind of blocking the sodium, as well as like phenytoin kind of does as well. So lamotrigine, which blocks again like the sodium influx, and then the valproate. Valproate is a little bit interesting too, as you can see, it kind of blocks both the calcium and the sodium. Um, I think I listed it here as well, the valproate. Um, it probably doesn't state in that picture there, but yeah, essentially it's going to kind of inhibit the excitatory activity by, preventing both, and increasing the GABA use. So that's pretty much the whole lecture on this. This is just a bigger diagram here, and that will kind of help you see things a little bit better. And you guys are free to use this as a study tool as well while studying for the exam, and anything you come across with. Like if you are going to help a patient understand, the uses of these seizure medications, at least now you know how they are being used. Um, so, does anyone have any questions so far? I'll just open it up for 10 minutes. If anyone has any questions, feel free. I understand some of you are trying to study really hard for the exam, and the purpose is really just to clarify things here, make things a little bit easier for you, so um, you at least have an essential understanding of medication topics, the mechanisms. And I mean, believe me, when you understand one of these mechanisms, you're basically going to understand a lot of other things that go along with those medications as well. Um, and I'll be sure to try to post a few shorts that might help you kind of boost your confidence on certain concepts when it comes to side effects and all, as you're studying for the exam. We'll also have some lectures on this. I kind of like it when I'm drawing it out for you so you guys can use those drawings, just to use it for your understanding. And I think that's pretty much it. We will stop here about 5 minutes. If anyone has any questions, feel free to ask now. And I do want to thank you all for participating in our review lecture for the night. I know it's a very short notice, um, but I assure you that there will be some structured review content posted in advance for you all to schedule or make plans before watching these videos. So we are still working on that, and um, we will let you know soon, how videos will go. So I hope this works out for you all. Anyways, I hope you all have a wonderful day, and take your time. Don't rush, because if you rush the material and just memorize, it's not going to do you much good. You should focus on the big picture stuff. Yeah, there are some small minor details, but some big picture stuff is going to help you a long way. So take your time, and don't hesitate to ask any questions on any concept or review, because there's still a whole lot of material that that still needs to be covered, and we are trying our best to make sure that you get every information needed before your next exam. So I hope that helps, and good luck. And also thank you for watching. I hope you all have a good day. Thanks. Bye.